Robin Hood Radio presents Your Health with osteopathic physician Dr. Kim Tripp, a show presented monthly on Robin Hood Radio, discussing the challenges faced and the solutions that are available for keeping vital health and well-being throughout our lives. And now, here's Dr. Tripp.
Hello, everyone. Welcome to Your Health with Dr. Kim Tripp, osteopathic physician. This is the health show created to bring you information and discussion of all kinds of health issues on your mind and in your life from the unique perspective of traditional osteopathic medicine. So first, as we always do for our new listeners, let's clarify what osteopathic medicine means. Osteopathic medicine is practiced by fully licensed physicians in the United States with a DO degree, a Doctor of Osteopathic Medicine degree. Our practice is based on the essential relationship in all living things between structure and function. In other words, the natural interdependence between anatomy and physiology, or that between the physics of the body and its chemistry. As osteopathic physicians, we use our comprehensive and precisely detailed knowledge of anatomy and physiology to promote health and healing in our patients. We work gently with our hands to help your body restore optimal function based on optimal structure. Our medical specialty is therefore called osteopathic manual medicine. We receive uniquely in-depth training in anatomy and physiology and their relationship within your body in the context of a full physician's medical training. Only U.S.-trained osteopaths are fully licensed physicians and have all of the current medical pharmacopoeia, nutritional science, and full medical training at our disposal. This means that your individual treatment may include a wide range of approaches, but it will always be founded on our gentle hands-on work. We practice from the unique perspective of first looking for the health in our patients rather than merely finding illness and disease. Our practice has been especially effective for, but is not limited to, musculoskeletal and other structural issues, as well as problems like chronic headache, gastrointestinal issues, post-concussive syndrome, sleep disturbance, allergies, etc., etc. We work together with you, the patient, to help you build health and vitality in your body, mind, and spirit as the solution for health problems, rather than only treating the disease symptoms. So in the radio show, we tackle health issues from this point of view. What can we do to help you build your health and vitality in order to prevent and heal injuries and disease? And we do that by giving you some basic information about the problem to help you understand what's happening, as well as offer solutions and guidance for helping yourself to heal and stay healthy based on our clinical experience with patients in our practice. Before we get started on today's topic, let me remind you that you can listen to all of the prior Your Health shows online at your convenience, such as the shows on back pain, nutrition, carpal tunnel, by going to the Goldman Tripp website, www.goldmantripp.net. Click on the radio show icon, then scroll down and click on the individual show by topic. There are now nearly 50 shows available. You can also get the most recent show podcasts on the Robin Hood Radio website itself in the on-demand section. Amazingly convenient. Today we're going to continue our series on the human endocrine system. That is, our system of glands that control so much of our physiology and function. To review a bit, the endocrine system glands produce and secrete hormones, that is, chemicals produced in the body that regulate the activity of cells or organs by acting as chemical messengers. These hormones are produced by the gland and then are circulated to the target tissues to regulate the body's growth, metabolism, and sexual development and function. The hormones are released into the bloodstream and they may affect one or several sets of organs, tissues, and or specific cells throughout the body. The components of the endocrine system are the hypothalamus, pituitary, pineal, thyroid, parathyroid, adrenals, pancreas, yes, part of the pancreas that we otherwise know from the digestive system, and the reproductive organs, the ovaries and testes. The endocrine system is regulated by what we call a feedback mechanism. That is, in an analogous way that a thermostat regulates the temperature in a room. Most of the glands are regulated by the hypothalamus and pituitary in concert together. The hypothalamus is part of your brain. The pituitary gland is a small gland that sits suspended from the hypothalamus and resting in a bony saddle in the middle of your skull, just below your brain. The hypothalamus and pituitary sample levels of different active hormones in your blood and respond to those levels by secreting controlling hormones that tell the glands to make more of their specific hormones if the levels are low, or in some cases actually inhibit those glands from making more of their hormones if the levels are high. The hypothalamus and pituitary are the controlling entities for most of the endocrine system. In general, the hypothalamus acts by controlling the pituitary, which then sends out the specific stimulating hormone for a given gland. The hypothalamus influences the functions of temperature regulation, food intake, thirst and water intake, sleep and wake patterns, emotional behavior, and memory. In the last show, we considered the thyroid gland. Today we're going to consider that pituitary gland that does so much of the masterminding of the endocrine system. And in fact, it's often referred to as the master gland. The hormones of the pituitary gland help regulate the functions of the other endocrine glands. The hypothalamus sends signals to the pituitary to release or inhibit pituitary hormone production. To release or inhibit pituitary hormone production. Recall that the pituitary gland is a multi-lobed, pea-sized gland that sits suspended from the hypothalamus at the base of your brain from a connecting slip of tissue called the infundibulum. The pituitary rests in a tiny bony saddle in the middle of your skull in the sphenoid bone of the cranium. It's covered by a slip of the same tissue that covers your brain, called dura. There are anterior, meaning front, posterior, meaning back, and very diminutive intermediate lobes. Altogether, the gland weighs only about half of a gram. But even though it's very small, it is a very mighty gland. The anterior lobe produces and releases hormones. The posterior lobe does not produce hormones per se. This is done by nerve cells in the hypothalamus, but it does release them into the circulation. The hormones of the pituitary gland send signals to other endocrine glands to stimulate or inhibit their own hormone production. For example, the anterior pituitary lobe will release thyroid-stimulating hormone to activate the thyroid gland, so it produces more thyroid hormone. Or in another example, will release adrenocorticotropic hormone, or ACTH for short, to stimulate cortisol production in the adrenal glands when you're stressed. The anterior lobe of the pituitary releases hormones upon receiving specific signaling hormones from the hypothalamus that can either be releasing or inhibiting signals. These hypothalamic hormones tell the anterior pituitary lobe whether to release more of a specific hormone or stop production of that hormone. The anterior pituitary lobe produces most of the pituitary signaling hormones, including thyroid-stimulating hormone, which stimulates the thyroid gland to produce thyroid hormones, ACTH, which stimulates the adrenal glands to produce hormones such as cortisol, which is associated with many aspects of metabolism and physiological function, including stress responses, and androgens such as testosterone, follicle-stimulating hormone, and luteinizing hormone. FSH works in tandem with LH to ensure normal functioning of the ovaries and testes. Growth hormone. Growth hormone is essential in early years to maintaining a healthy body composition and for growth in children. In adults, it aids healthy bone and muscle mass and affects fat distribution. Prolactin. Prolactin is best known for stimulating breast milk production, but more recently, research has indicated involvement of prolactin with many other systems and functions, including the immune system. The posterior lobe of the pituitary includes the ends of nerve cells descending directly from the hypothalamus. The hypothalamus sends hormones directly to the posterior lobe via these nerves, and then the pituitary gland posterior lobe releases them into circulation. The two posterior lobe hormones are antidiuretic hormone, which stimulates the kidneys to increase water retention in the blood. It acts against any diuretic or water-releasing influences, hence antidiuretic. And oxytocin. Oxytocin is involved in a variety of processes such as contracting the uterus during childbirth and stimulating breast milk production. The coordinated functioning of the hypothalamus of the brain and the pituitary master gland is referred to as the hypothalamic pituitary axis, or HPA. The hypothalamus can be considered the coordinating center of the endocrine system. It consolidates signals derived from the central and autonomic nervous systems, environmental cues such as light and temperature, and feedback from the endocrine system organs, such as the thyroid, ovaries, or adrenal glands. In response, the hypothalamus delivers precise signals to the pituitary gland via either the hormones released to the anterior lobe or through the nerve endings that traverse through to the posterior lobe of that pituitary. In response to these precise signals from the hypothalamus, the pituitary then releases hormones that influence most endocrine systems in the body. Specifically, the hypothalamic pituitary axis directly affects the functions of the thyroid gland, the adrenal gland, and the ovaries and testes, as well as influencing overall growth, milk production, and water balance throughout the body. The hypothalamus and the pituitary then respond to the subsequent production of hormones by the responding glands that changes the blood levels of these hormones. If they get too high, the hypothalamic pituitary axis then either ceases to stimulate those glands or disperses actively inhibiting compounds, preventing further hormone production. If they remain too low, the HPA axis will continue to stimulate that lagging gland. This allows the hypothalamus and pituitary together, that HPA axis, to maintain the closely controlled normal cycling levels of all of the endocrine hormones in balance with each other and in response to the changing physiological demands and growth and energy needs of the body. The hypothalamus is also involved in several important non-endocrine functions, such as temperature regulation, the activity of the autonomic nervous system, and appetite regulation. In such a fine-tuned and constantly adjusting system, there are many clinical issues that can arise. The ongoing marvel is how remarkably well the system works in the face of all of the physical, emotional, and chemical challenges that we constantly throw at it from birth through childhood, adulthood, and into old age. Here are a few of the main issues. Pituitary tumors, also called pituitary adenomas, are the most common pituitary disease, and many adults have them. However, they are not, in the great majority of cases, life-threatening. But that doesn't mean they're necessarily completely harmless. Pituitary tumors can disrupt the gland's normal ability to manage and release hormones, thereby potentially disrupting endocrine function in many systems. Remember, the pituitary is the master gland. There are two types of pituitary tumors, secretory and non-secretory. Secretory tumors secrete too much hormone, and non-secretory tumors don't secrete excess hormone. Pituitary secretory tumors can result in hormonal overproduction, causing serious endocrine disturbances, such as acromegaly from too much growth hormone, Cushing's disease from too much ACTH, or prolactinoma from too much prolactin. A secretory tumor that is overproducing thyroid-stimulating hormone will give you hyperthyroidism symptoms. Other pituitary adenomas are non-functional or endocrine inactive, meaning they don't produce excess hormones. Instead, as these tumors enlarge, they can cause compression of the normal pituitary gland, leading to decreased or absent hormone production, called hypopituitarism or pituitary failure. Visual loss from optic chiasm or optic nerve compression and headaches are another possibility. A wide range of simple or complex symptoms can be indicative of pituitary or HPA problems, including symptoms due to dysfunction of individual glands like the adrenals or thyroid, which may be dysfunctional because the pituitary is not sending out sufficient stimulating hormones for these apparently dysfunctional glands. For example, deficiencies in growth hormone production by a dysfunctional pituitary can lead to growth delay in kids. In adults, deficiencies in growth hormone production can result in decreased muscle mass, increased body fat, elevated cholesterol, low bone density, or osteoporosis, impaired psychological well-being, or poor quality of life. Decreased follicle-stimulating hormone or luteinizing hormone production can lead to decreased libido, erectile dysfunction, irregular or absent menses, decreased body hair, decreased muscle strength, hot flashes, or mood changes. Decreased ACTH production can lead to poor appetite, nausea, weakness, vomiting, low blood sugar, low blood pressure, dizziness, and body aches. And decreased thyroid stimulating hormone can lead to fatigue, weakness, cold intolerance, dry skin, constipation, heavy or painful menses, weight gain, body aches, memory loss, or mood disturbance. Decreased prolactin can interfere with the ability to lactate. Decreased antidiuretic hormone can lead to frequent urination and unquenchable thirst. Pituitary apoplexy is another pituitary disorder. In some cases, pituitary function can be suddenly disrupted due to trauma or bleeding from stroke, creating a dangerous shortage or imbalance of vital hormone sensing and production. Any significant head injury could be suspect for HPA dysfunction, including many concussions. Because the hypothalamus is at the base of the brain, and the pituitary is suspended from a stalk of tissue below it and resting in the sphenoid bone, any impact to the head could potentially cause inflammation or positional derangement of these key tissues, and therefore negatively affect the circulatory relationships that are so crucial to the ability of the pituitary and hypothalamus to sample the blood for feedback and to release hormones into the blood itself. Osteopathic physicians who are specialists in osteopathic manual medicine have particular expertise in evaluating and treating many head injuries and can be especially helpful with these kinds of problems. There is a complex condition known as empty sella syndrome, or ESS, named for the little bony saddle in the head where the pituitary gland should be found, called the sella turcica. ESS is often discovered during radiological imaging tests for pituitary disorders. ESS may result in no symptoms or may lead to symptoms resulting from partial or complete loss of pituitary function, including headaches, low sex drive, and impotence. There are two types of ESS, primary and secondary. Primary ESS happens when a small anatomical defect above the pituitary gland allows spinal fluid to partially or completely fill the sella turcica. This causes the gland to flatten out along the interior walls of the sella turcica cavity. Primary ESS may lead to high levels of the hormone prolactin, which can interfere with the normal function of the testicles and ovaries. Primary ESS is most common in adults and is often associated with obesity and high blood pressure. Sometimes the pituitary gland may be smaller than usual, brought on by high pressure within the skull. Secondary ESS is the result of the pituitary gland shrinking within the cavity after an injury, surgery, or radiation therapy. Secondary ESS can sometimes cause symptoms that reflect the loss of pituitary functions, such as cessation of menstrual periods, infertility, fatigue, and intolerance to stress and infection. People with ESS can have complex health issues and need care by an endocrinologist, that is, a physician who is a specialist in the endocrine system. Additionally, a long list of environmental pollutants and agricultural chemicals have been found to disrupt endocrine function in people and animals. So be very cautious when using any landscape or household chemicals. These chemicals are called endocrine disrupting chemicals, logically enough, and they're defined by the World Health Organization as, quote, an exogenous substance or mixture that alters functions of the endocrine system and consequently causes adverse health effects, end quote. The UN published a list of these chemicals in 2018, and more information on this is available at www.unenvironment.org. In concert with all of its regulatory effects, the comprehensive endocrine system is intimately involved with the nervous system and the immune system and can have profound effects on all aspects of our general well-being and health. Any new or concerning symptoms should always be evaluated by a physician. If you think you may have a hypothalamic pituitary axis problem, you should be evaluated by a physician and potentially also by an endocrinologist. The pituitary gland is key to the complex integrated function of your entire endocrine system and therefore to your overall health. Through coordination by the hypothalamus, the pituitary really does serve as the master gland that ensures that all these complex, integrated physiological functions remain in normal and appropriate balance. So how do we keep our hypothalamus and pituitary healthy? Eat a well-balanced, toxin-free diet. Maintain adequate hydration and avoid head injuries, smoking, excess radiation, and environmental pollutants. Avoid using any supplemental hormones unless used with the direction of a knowledgeable physician. Get plenty of fresh air, stretching, and exercise that helps minimize stress, stimulates your respiratory and cardiovascular systems, and keeps your neck flexible and strong to ensure good blood flow and lymphatic drainage to and from the head and brain. Which brings me back to osteopathy and to the close of today's show here with a reminder that an osteopathic physician who is a specialist in osteopathic manual medicine can be very helpful for endocrine issues of all kinds. Working gently with our hands with the involved organs, nerves, vasculature, fascias, capsules, and associated tissues to release restrictions in the physical tissues of the glands and diaphragm and blood and lymphatic flow, as well as to help balance the autonomic nervous system function based on anatomical detail, and to help with nutritional issues and support for whatever procedures or treatments you may be going through. Recall that all of the endocrine system is a complex physical entity with connections between all the parts that need to be open, flexible, and moving freely, with excellent neural conduction from the nerves, optimal arterial and venous blood flow, and lymphatic drainage to remain healthy, vital, and functioning normally. So here we are at a time again. This concludes the next in our series on the endocrine system. But you can revisit these show podcasts anytime on the Goldman Tripp website. Meanwhile, thank you for your attention to Your Health with Dr. Kim Tripp. You can email your comments and suggestions for topics to yourhealth@robinhoodradio.com. If you have a health issue yourself and would like to find out about how we might be able to help you in our practice of traditional osteopathy, we are at our offices in Sharon, Connecticut. Dr. Kim Tripp and Dr. Andrew Goldman, Goldman Tripp Osteopathic Healthcare, 860-364-5990, with evening hours Wednesdays and Fridays, or on the web at www.goldmantripp.net. I'll be looking forward to being with you next time. Till then, take care of yourself, enjoy your health, and thank you for listening.